Hey, my name is Dr. Sasha Thomason. I am the Animal Facilities Inspection Program Director for the Kansas Department of Agriculture. Welcome to the first AFI webinar of the year. I appreciate you taking time today to view this webinar with us. Cleaning and disinfection considerations to prevent select cat diseases. Common feline diseases and the proper disinfection practices to combat them. So for the next 60 minutes, we will be focusing on this topic. It's important to KDA license holders so that they can improve the health of the animals in their care and reduce the spread of disease. A few housekeeping items though. Before the session begins, or during the presentation portion of the session, all participant microphones will be muted by the host. Also, if you have a question during the presentation, just put it in the chat button at the bottom of the screen. Our staff will be monitoring that and we'll make sure we get your questions answered at the conclusion of the presentation. And then this session is being recorded and will be posted online for viewing next week for those of you that can't stay for all of it or couldn't catch it during now. So without further ado, I'd like to introduce Dr. Titch. Dr. Titch grew up in a small village in the Midlands province of Zimbabwe. He received a scholarship to study veterinary medicine in Cuba. He received his DVM in 2015 and worked in several shelters, rescue organizations, private clinics in India, Oman, Malawi, and Rwanda. So he is currently finishing an internship in shelter medicine at the Kansas State University's vet school and is excited to start a residency, or is about to, at the University of Wisconsin-Madison. So at this time, I'll turn it over to Dr. Titch to share his presentation.
Okay, good afternoon, everyone. So my name is Tichao Namurampinda, and I'm the shelter medicine intern. And today I'll be presenting about the common feline diseases and proper disinfection practices for them. So when I'm talking about the common feline diseases, I will talk about the feline upper respiratory tract disease. So this is a complex of 5 diseases that we'll be talking about today. And then I'll talk about the panleukopenia. I'll talk about the dermatophytosis. These are some of those which are really important in shelter and as feline infectious diseases. And also I will go about and mention a little bit about feline FELV, which is feline leukemia virus, and the FIV, feline immunodeficient virus. And then I will then wind up by talking about some common disinfection practices. Later on. Okay, so to begin with, when I'm talking about the feline upper respiratory tract disease, I'm talking about a group of diseases which are caused by feline herpes virus 1, feline calicivirus, a chlamydophila felis, Bordetella bronchoseptica, and mycoplasma. So these are the 5 diseases that make up that complex, the URI complex that I'm going to be talking about today. So to cut a long story short, I'll just go into talking about the feline herpes virus, which is one of the most common that we normally see in our shelter settings, okay? So to understand this disease, you have to understand the microbiology part of it, like the agents that are causing this feline herpes virus. So the agent that causes it is called the feline herpes virus 1. So formerly, for people who have graduated a little bit a while ago, they used to call it the rhinotracheitis virus, okay? So it's an envelope virus. Why is it important to know that it's an envelope virus? So when you're using the disinfectant that you're going to be using, when you're cleaning, let's say a shelter, you need to select disinfectants that normally the mechanism of action of those disinfectants is that they act on the outer layer, which is the outer layer of the virus. So that's how they denature and increase the permeability of those membranes. That's how they denature or they kill that virus. So knowing that it's an envelope virus will help you in the selection of that disinfectant that will be selecting. Okay, so we know that also it's a DNA virus. It comes from a genus of a varicella virus. It's subfamilies in alpha herpes viridae. So when I'm talking about alpha herpes viruses, even in humans, we have a herpes virus complexes as well. So when a person is like stressed or a kid is stressed, you see some flaring up of some like ulcers on the edges of the mouth. So that's the same thing. They come from the same family, but even though they are species specific. So the feline is actually specific for the feline, and the complex one, which is the herpes complex one, is specific for humans. So their properties are almost the same. So they have a short replication cycle, which means you can produce a large number of microorganisms per unit area, which means if let's say an animal is infected by that virus, right? They shed a large amount of microorganisms which will contaminate the whole area. So because of the short replication cycle. The other thing is the induction. Let's say the animal is infected by it, you will see the symptoms that comes with it. So after those symptoms like disappear in 10 to 14 days, you will see the viruses will disappear, will go into what we call the primary. It will stay in the trigeminal ganglion or the nerve roots. That's where it's going to hide from the immune system. So hiding from the immune system, then when there is a stress, you release a lot of cortisol. So that lowers your immune system. And then this virus will take advantage of the low immune system and then will come out. So that's the characteristic of this herpes virus. It will always come out when there is a stressful event. Let's say if it's in a household, you move furniture from one place to another. Cats don't like any change that happens in a household. Or let's say it's moved from its household to a shelter. It's a new environment. So that stresses them out. They release cortisol. And these microorganisms, like the alpha herpes virus, they are already in their trigeminal ganglion. They will move out of that, and then they will cause the characteristic symptoms that we normally see. So when it comes to understanding this disease, you have to understand the incubation period of this disease. So the incubation period in shelter medicine, if we're going to reason around how you analyze the disease as it is, you have to understand the incubation period. It's normally for the herpes virus is around 1 to 6 days. So the importance of understanding the incubation period is when there is an outbreak, for example, you will know exactly when these animals are going to show the symptoms. The importance of understanding when they are going to show the symptoms is because you want to understand the shedding period. Whenever you see the symptoms, it means these animals are already shedding, okay? So they are going to be shedding, and when they are shedding, they are contaminating the environment, and they are at risk of infecting other animals at that period of time. So understanding the shedding period will also help you to understand when you're going to quarantine these animals, right? So the shedding period for feline herpes virus is around 1 to 3 weeks. So that is the period that you're going to quarantine this animal or to isolate it, to move it into an isolation area so that it doesn't infect other animals. So these numbers are important when you are reasoning, especially in a shelter setting or even in a household or wherever you'll be managing like the feline population. It's important to understand those limits. So when an animal recovers after it got the feline herpes virus, 80 to 100% will remain latent carriers. It means they will still have this herpes virus in their body. When a stressful event comes out, then that's when they're going to start getting sick after that. So they will wait for a stressful event for that. Okay. So also the other parameter that you should be understanding is the survival in the environment. So the virus will only survive for around 1 to 2 days. Why is the importance of that? So let's say you are having a kitchen and it moves into your garden place, right? So, and it contaminates that environment. You have to know if you're going to bring another cat, which is probably without the symptoms, you have to understand how long is the microorganism in that environment, which is probably difficult to disinfect or to clean. How long are those microorganisms going to be there? So as to understand when I'm going to move there. If let's say you're going to bring a new cat in that place where at least you know that after 1 or 2 days, the microorganisms will be dead. So you know that after 3 days, even if I didn't clean that area, the microorganisms will be dead. So I will be able to move an animal in there. So those are the importance of that. So is it a disease that is transmitted from cats to humans? No, it doesn't transmit from cats to humans. The transmission, which normally the transmission of this disease happens through like direct contact. When you put two cats, one without a herpes virus and one with it, just that direct contact between the cats will actually lead to the transmission of the disease. Formite, when a cat is having eye discharge or is having respiratory infections, and then a worker goes and touches the cat and comes again and touches another cat which doesn't have the symptoms, and that's how you initiate like in the transfer of these microorganisms. Okay, so the prevalence is around 90 to 95%. The other thing that I didn't put in this PowerPoint is, so feline herpes is ubiquitous. It's available everywhere. Almost all the cats have it, unless if the animal is born in a lab, which is a controlled environment. But if it's, as long as it's born in this, like in these normal conditions, will be having it or be exposed to it. Okay, so the morbidity and mortality is significantly higher in kittens. That's when we're going to be seeing fever, depression, inappetence. So what are the clinical signs that you see other than the ones that we've talked about in kittens? Sneezing, nasal and ocular discharges, conjunctivitis, oral ulcerations. They're less common because they tend to make us confuse them with caliciviruses. Then we normally see also the chronic ocular lesions and the rhinosinusitis. You can see a photo that I put down there. It's one of the characteristics of feline herpes virus. So when we are treating this particular disease, that the herpes virus is in a shelter setting, and normally we do a physical examination, we look at the history and physical examination of that particular animal, and then to reduce the symptoms, they normally use human antiviral drugs that we normally use for that. Like for systemic treatment, we're going to use like famciclovir, and then that will help to reduce the symptoms. There are studies out there that support the treatment of that. And also, you can also use acyclovir, which is an eye drop that you can apply on the eyes when the animals really get bad, and you can help to reduce some symptoms. So that's just part of the treatment of the herpes virus. So I'll move quickly to calicivirus. So calicivirus, for you to understand it as well, you have to understand the agent characteristic. What is it that is the calicivirus that we're talking about? So first and foremost, a non-envelope RNA virus. So knowing that it's a non-envelope, it means it doesn't have that outer layer where our disinfectants, most of them, they will act on, like when they are destroying that, the calicivirus. So they don't have that outer layer. So which means they're actually the most difficult ones to deal with. So when you are selecting your disinfectants, you have to consider, you have to look at which ones actually kill the non-envelope portion of these viruses. So the other thing is also it has a small genome, which is around 10,000 kilodaltons. So RNA viruses, they are known because they have this small genome. So the other characteristic that makes it so difficult to deal with is hyper-base mutation rate. What does that tell you? It tells you that we are going to produce large numbers of microorganisms per unit area, as well as we are going to have different strains with different pathogenicities that we're going to be producing when they are mutating. So that's why it's so difficult to make the vaccines for this particular, like calicivirus, because it is of this hyper-base mutation. They can just make different strains with different pathogenicity. And we'll talk about the one which is the virulent systemic feline calicivirus later on in this PowerPoint. So moving on from that, the cats are the most susceptible. The susceptible species are the cats. It's not zoonotic. You cannot transfer it from humans, from cats to humans. And the transmission is through direct, like contact between an animal with another one. If you have like group housing, or if a worker goes and starts medicating animals with the same syringe, you use this, and without changing the syringe from one animal to another, that's how you transmit some of these, the calicivirus disease. Incubation period is almost the same as the herpes virus one. It's for 1 to 6 days. So the two viruses, the herpes and the calice one, their incubation period is shorter. But for the bacteria, you will actually see when you present it, it will be a little bit longer. So the shedding period, there was no proper data which points out exactly what is the shedding period of this virus. So they did a research which was interesting in 2016, where they did a PCR on the cats which were having caliciviruses, and they find that at 30 days, 100% were still shedding. And then after 75 days, 50% will still shed. And then few cats remain lifelong shedders, which means that this particular virus, you already understand that it's a difficult one, it's difficult to even disinfect. And now you understand that it's when the animal has it, they are shedding it. Some of these, they remain shedding for the rest of your life. This creates a very big problem when you're trying to manage a shelter or a breeding facility or whatever the scenarios that you'll be dealing with. It's so difficult to deal with this kind of bacteria because some of these animals will remain shedding forever. So when you are using the shedding period as your quarantining period, you are just going to quarantine, you are as an isolation, like looking for the days in which you are going to isolate this animal. The only thing that you are going to be taking into consideration is when the animals are showing some clinical signs. Because if you are going to use the shedding period to determine the isolation period, some animals are lifelong shedders, so it means we are going to put them in isolation forever. So survival in the environment, we already know that it's a hard virus. So the research out there says most of these microorganisms, they live for as much as 28 days. Some research say around 10 days, but if you have an area that is contaminated with this calicivirus, right? The only thing that you have to do is, if it's difficult to disinfect, or let's say it's like a garden or something like that, you have to leave that place without contamination, and without bringing another new animal there for at least 20 days, as long as if that animal is not vaccinated. Okay. So the morbidity and mortality depends on the on the virulence of that microorganism, like the pathogenicity. The one which is called the virulent systemic feline calicivirus is around 33 to 50%. So that is the one that causes like multiple organ failures and stuff like that. So it's one of the most aggressive one of the calicivirus. So the clinical symptoms that you normally see, so in the most classic and closer to the pathognomonic lesion that you normally see for the calicivirus is when you see a kitten that is limping with upper respiratory infections, oral ulcers, and high temperature. Those are the most important things. That if you see the combination of those symptoms, it's highly likely that it's calicivirus. So the oral ulceration, sneezing, nasal and ocular discharge, lameness, and skin lesion are some of the most important things that you need to remember when you are facing the calicivirus. So that's I wanted to mention about calicivirus. It's so difficult to treat. So the way you are going to be managing it is trying to be using the antibiotics only to treat the secondary bacterial infections and using the supportive care, because when a cat has like oral ulcers and upper respiratory infections, what they normally do is cats want to smell, like to smell the food. And then when they have this upper respiratory infection, they have the trouble in getting that smell. So it will reduce like the way they eat the food as well. And the oral ulcers, it will be unpleasant for them to eat. So you'll be observing the way they'll be eating and supporting them before they develop like lipidosis hepatica, which is one of the complications that comes with that disease in particular. So you have to support your cat through that infection. So let me jump over to the bacteria section now. So I'm going to talk about the Chlamydophila felis. This is one of the agents also. It's one of the common agents that you normally find in shelters, which is one of the infectious diseases. And I think at Tiraso, I've seen like 2 to 3 cases that are having this particular disease. So normally it's a gram-negative obligate intracellular bacteria. Why is it important to know that it's a gram-negative? Because that's the information that you are going to use when you are selecting the antibiotics in treating this. Why is it important to know that it's an obligate intracellular bacteria? These characteristics are important in a shelter setting or when you want to understand this disease, because it will tell you the mode of transmission of this disease. So one, it will tell you the mode of transmission. It will also tell you the way they survive in the environment. When it's an obligate intracellular bacteria, it means it will not survive long outside its host. So you are not going to worry about it's contaminating that environment because they are going to be dying afterwards. But also, it's if you are going to prevent the transmission of this disease, or the way at which it is transmitted is through close contact between animals. Both is obligate intracellular bacteria. One cat. So if you have a cat which is sick, so anything like the cages around that cat should be empty, because when they have this contact, you will be able to transmit that disease to other cats. It's not zoonotic, but if you are a person who is immunocompromised, there was a research that some people who were immunocompromised ended up having, or that eye which is infected with Chlamydophila felis. The clinical signs are the most common ones are the conjunctivitis, which is normally unilateral. It looks like this Halloween eye, the way it presents itself. If you Google and look at the Chlamydophila felis in cats, it's this ugly eye that is actually scary. So you see things like blepharospasm, like the blinking, the chemosis, and the serous or mucopurulent ocular discharges, the green discharges that that you'll be seeing on the eyes will actually tell that is a bacterial infection. Okay, so those are the photos of the case that we have in Chlamydophila felis. So let's jump to Bordetella bronchoseptica. So this is one of the the fourth one of the diseases that make that complex of the respiratory disease. So it's a small gram-negative word. I'm sure on the presentation that will be happening for dogs, for the common infectious disease in dogs, this is one of the common diseases that they normally talk about. So it is a gram-negative. It's important to know when we're selecting the antibiotics. The other thing that you have to know is the species that normally have it: dogs, cats, rabbits, horses, rodents, and pigs. So if you have a dog that is having, in your household, a dog is having like Bordetella bronchoseptica, which is this dry wonking cough, and there is a high likely chance that it can also be transmitted to a cat in the same household. So it can jump from dogs to cats or from rabbits to cats, like that. Also, it's not zoonotic unless if you're an immunocompromised person. It can also as well jump from cats to humans, okay? If you're immunocompromised. The transmission is the same way: direct contact between animals, aerosolization, and through when you're sneezing, like the droplets can also help in the transmission of that. The format: a worker goes in to touch a dog and then comes in and touch a cat, a dog which was infected with Bordetella. That's how you transmit that infection. Even the fluids of the animals have a significant amount of the Bordetella in there. So I didn't put things like shedding period, because the shedding period, there was a research which was done. They did a research on some of the animals and find that at 19 weeks, these animals were still having the Bordetella in their system, but they could not know if that quantity was enough to really cause infection, to actually to say it is still shedding. So there was no clear data in the literature that I actually consulted about it. So the shedding period is a little bit vague. So what are the clinical symptoms that you normally see? Oculonasal discharges, which are green, or the mucopurulent ones, the sneezing, fever, lethargy. Coughing is less common in cats than in dogs, but you can also see the symptoms are actually more severe in kittens. Okay, so let's talk about mycoplasma, which is the last one in this complex of the upper respiratory disease. Mycoplasma SPP is gram-negative. We know that it's a microflora norma of the upper respiratory system. But if you find it in the lower respiratory system, then that's when we're going to be worried about it, because we know that it is the one which is causing some infection. You are not supposed to find it when you do the bronchoalveolar lavage. And then if you find mycoplasma there, that's actually a sign that there is a problem there. So on the agent characteristic, this microorganism lacks a cell wall and lacks peptidoglycans. Why is it important in shelter medicine? For people who are interested in pharmacology, they will know that lacking a cell wall will help you when you are selecting the antibiotics. All the antibiotics that you normally do in the treatment of the upper respiratory disease, the antibiotics that you select, normally you have to select, normally people go and select like amoxicillin, clavulanic acid, which are some of the antibiotics that act on the cell wall. But if you are going to treat an upper respiratory infection in a cat, like in a broader way, you should avoid antibiotics that actually act on the cell wall, which have the mechanism of action on the cell wall. And you have to look for antibiotics that act inside the cell, like doxycycline, and try to avoid anything like carbapenems, penicillins, and cephalosporins, because they act, their mechanism of action is on the cell wall, and this microorganism doesn't have it. What are the characteristic symptoms that you normally see with mycoplasma? Yeah, they are almost like the lower respiratory tract diseases, like pneumonia, bronchopneumonia, and pyothorax. So How do you treat this upper respiratory disease complex? And we understand that it is really high complex. There are multiple infectious agents that are actually involved. The factors that are actually involved are things like stress, environment, change, overcrowding, and poor hygiene and ventilation. They actually create this condition for this microorganism to affect most of the animals in shelters or in breeding facilities. We also know that, so you have to, when you are doing the treatment, you have to try to avoid, you have to deal with the environment, you have to deal with stress, you have to deal with poor hygiene and ventilation, which we'll be talking about in a while. So herpes virus, we understand that is constitute like the majority of the diseases that you normally see, which is the upper respiratory. If I have a cat that is sneezing in a shelter setting, I will first put in on my list of the differentials is the herpes virus. We have Calis virus and Bordetella, which are sporadic. Then we have Chlamydophila felix, which is uncommon, but also is problematic. And actually, currently on the shelter, we have cases which are actually which we suspect that are highly likely they have Chlamydophila felix, and on treatment that we are seeing some improvement on them. Then Mycoplasma is always there. It just takes advantage of the weak. It plays a role as it's a secondary pathogen, so it just takes advantage of something that is happening with the animal, and then it affects the animal. What are the standardized procedures? You have to do the disease identification, knowing which one of those diseases are high likely from the symptoms that we talked about. The next thing is to quarantine or to isolate that animal. The second thing is to do the treatment, which is aimed at decreasing the stress, preventing or addressing secondary bacterial infection. So when you are selecting the antibiotics, the first one which should be on your list for the upper respiratory disease complex is the doxycycline and or the tetracyclines, which could be the pills, or you can use for Chlamydophila felix, for example, you can use the eye ointments for that. Okay, so that's all I want to talk about the feline upper respiratory disease complex, and then I'll move on because I'm sure my time is a little moving faster. I have a lot of ground that I have to cover today. So I'm going to move to talk about the panleukopenia. The first one that I wanted to talk about is the characteristics of the agent. It's a non-enveloped single-stranded DNA parvovirus. The susceptible species, normally cats, but we normally see it in kittens between 2 to 5 months old. It's not a zoonotic, so the transmission is fecal oral, direct through the contact between the animals, or the format where workers don't observe the biosecurity measure. They move from one kennel to another without changing gloves or washing their hands, and then we end up transmitting this. It's highly contagious. So the incubation period is around 2 to 10 days. The reports, they say it's usually 5 to 7 days. It's important to know the incubation period for the reason that I explained that. So you know when there is an outbreak, when are you going to be expecting the symptoms, and when are you going to quarantine to put these animals in isolation. Shedding period is a little bit different for this particular disease because it sheds like few days before the symptoms appears, and then during the appearance of the symptoms, and also 6 weeks after the clinical recovery. When you think like, oh, now my animal is recovered from a panleukopenia, is still actually shedding the virus. So you will still be secreting the virus, is contaminating other animals. So you should be really be careful with this microorganism. But now, when I'm making a decision of when to quarantine, when to isolate this animal, it has to start a few days within, if you know, like it was the incubation period, or when this animal was exposed, you have to start at least a few days before, during the incubation period, and or during the period that we're doing the treatment, like the appearance of the clinical symptoms. And then afterwards, you have to do at least 3 weeks after the symptoms have disappeared. There are studies that have said it's not ideal to wait for the 6 weeks, because at 3 weeks they will have they have a lot of antibodies that are already circulating that neutralizes this virus. So in that way, that's the reason that you can move them from the isolation into the adoption flow, and there's a less risk chance of infecting others. So that's what the literature says. But just be cognizant of the fact that until 6 weeks, they will be still producing these microorganisms and shedding these microorganisms and infecting others. Okay, so the survival in the environment is nearly a year. So if you let this microorganism in the environment where you are not going to be able to disinfect, So you have to leave that environment without bringing a new animal that is at risk until a year. So it's important in the management to understand that. What are the clinical symptoms that normally see? Depression, fever, vomiting, diarrhea, sudden death. When I have like young kittens, and then there is a sudden death of an animal on my list, on my differential, on the top of my differential list is going to be the feline panleukopenia. So the treatment for this, when you put in the isolation, you should give an aggressive treatment where you're going to go and deal with the symptom. Based on the symptom that you see, if it's vomiting, you are going to give an antiemetic. If there's a diarrhea, you're going to give some fluids. You treat based on the symptom that you're going to be seeing there, okay, and correct like the dehydration status of that. So the morbidity and mortality is variable depending on the age and vaccination status. So on the vaccination, there are acute vaccines and there are modified live vaccines, which will give subcutaneous or IM. The efficacy of them is excellent. I will personally go for the modified live vaccines because I know that they stimulate the immune system faster and I don't have to give various boosters every time. So, you know, the schedule of vaccination of panleukopenia with FV-CRP, which is the vaccine that we normally use, we start at 8 weeks and then we do it at 12 weeks. We normally go, if in some cases go until 16 weeks, because we understand about some influence of maternal antibodies in the vaccine. And then we repeat yearly, the year annual vaccinations. I try to not to give killed vaccine that much because it increases the amount of time that you have to go to the vet, because we understand the killed vaccine, the immune system, they stimulate the immune system. It's in an excellent way, but you have to repeat, you have to give a lot of boosters of it, which is probably for me a little bit inefficient compared to the modified live vaccine. But again, modified live vaccines as well, they have an advantage that they stimulate the immune system faster, and also there's the disadvantage, which is big one, that is they might even like convert into a pathogenic, they might be pathogenic or they might like mutate into causing a disease into that animal. So which is something that you have to be considering on there. So there is no career stage for this one. I'm going to run also into dermatophytosis, which is ringworm. So one of the common diseases that you normally see is the ringworm. So ringworm is caused by Microsporum canis. There's also Microsporum gypsum. When the cat has contact with soil, we might get Microsporum gypsum. There is also a trichophyton mentacrophyte, which is also part of the microorganisms that you normally see for dermatophytosis. So for these ones, the most important one that we normally consider is Microsporum canis. It's by far the most common, and it causes 90 to 98% of the cases that we normally see in shelter caused by the Microsporum canis. So the species that are susceptible, cats, dogs, and some ferrets, is zoonotic. So if you're having a cat which is having ringworm, you should know that actually it can be transmitted to humans, okay? So you should observe how you're going to be dealing with this animal. Incubation period is around 2 to 3 weeks. Quarantining period, which is the shedding period where the animal is going to be producing a lot of spores in the environment, is 2 to 4 weeks. So the spores will be present on the air or just direct contact with the animal that is having these spores on its fur, which constitutes this formite, and you can be able to transmit this spores to another animal, or the contamination of the environment when these spores are being produced. We have to understand that these spores are highly resistant and can persist in the environment for a year. So if you have a cat with ringworm and you have, like, let's say a carpet in your environment, you have to know that that cat will be producing a lot of these spores for 2 to 4 weeks, which is like the whole, this is going to contaminate that environment. And that environment is going to remain contaminated for nearly a year. So that's why you have to be observing what you're going to be doing with this animal. It's so resistant. Okay, so the clinical signs that you normally see, we will see this. They are varied. Yes, when you are looking at it in a cat, you see this severe alopecia, crusting, scaling, erythema, pruritus, hyperpigmentation, ear margin inflammation, things like pododermatitis and papules and pustules that normally see. I'm sure some of these are you can see these lesions that are secular. This is the common that you normally find, but in some cases you don't normally find them as secular lesions. You will find them presenting in different forms. So it's variable the way it presents. So how do you do the diagnostic for dermatophytosis? You look at the history. You do the physical examination. We will pick the clinical symptoms which we talked about above there, and then we do wood slam, which, because of this microorganism, Microsporum canis, the advantages of it is when you're using the wood slam, it fluoresces. That's where you are going to see the apple green color that normally comes with this. So 50% of the of Microsporum canis, they normally produce this metabolite, which we normally see as it fluoresces with on the wood slam. So the easiest diagnostic tool that we normally use in shelter, which is cheap and readily available, which you can find, which you can easily identify if it's Microsporum canis or not. Then the gold standard is doing a fungal culture, which is the DTM, where we are going to take the samples and then we'll culture them for at least 3 weeks. And then we're going to see the colonies that you normally see for the Microsporum canis or Microsporum gypsum. Okay, so that's how we are going to be doing the diagnostic. Once you know that, the treatment which we are going to be using is the topical and the systemic antifungals. So the systemic antifungals, they normally use the selection that is normally ideal is to be using itraconazole. And some people talk about terbinafine. It's still good to use it, but itraconazole is one of the best ones to be using. For the topical ones, normally people use the shampoos, the 2% miconazole and chlorhexidine. That's what's normally which you can use for that. But I don't recommend using things like the creams, because normally cats will just leak it out and it will not be that efficient. So that's how we are going to be treating it. So the treatment is long. We are going to do it basing on like 2 to 4 weeks as well, and to see if there is any improvement in that. So there's no career state in that. So these are the photos of the cats that are having all the different lesions from the different forms of lesions that you normally see with Microsporum canis. Okay, so we'll talk about the disinfection basing on what you're actually understanding about this microorganism. So I will talk about the feline leukemia virus. We're almost reaching to the end. There is feline leukemia and the FIV, and then we'll be winding up with the disinfection. Okay, so feline leukemia virus is an envelope RNA virus. We know that it's obligate intracellular as well, so it doesn't really stay out of the environment. So I'm not worried about serious disinfection because it doesn't stay outside the environment. So the cats are the most ones which are affected. It's not zoonotic. The transmission is primarily through saliva and milk. You can see it also in blood and urine. Direct contact so the direct contact or formite also lead into this transmission. So it's normally referred to as a friendly cat disease, because it's all the cats that like grooming, playing around with others, not fighting, but just grooming and playing around each other. They have a high risk, or sharing the same balls. You have the high risk of transmitting this, of getting this particular disease. So the incubation period, once you get exposed to it as a cat, the incubation period is around 4 weeks. And then we have this viremia, and then we see the clinical symptoms. And then there's this latent phase between the viremia, which happens in 4 weeks. And the latent phase will last for some months, and then we end up saying, we start developing the symptoms. So during the latency, which is probably an active phase, but it's a quieter stage, during that stage, this leukemia viruses will be developing, will be affecting the immune system, especially the white blood cells. So once you see the symptoms, it means actually it has weakened the immune system. That's when you start seeing those symptoms. So the clinical symptoms that you normally see is the kitten-infantry syndrome, the chronic inflammatory conditions, neoplasia, and secondary bacterial infections that normally sit there with FELV. More treatment, once you get it, there's nothing that we can do. We can do supportive therapy and palliative care, but we can't treat this. They have tried different types of antivirals, but there's no a good report of their efficacy, especially the ones that are in human medicine. So for morbidity and mortality, there is a general reduction in life expectancy. But when we are doing the diagnostic with ELISA, like most of the places, they do an ELISA test on the animal, and then they find that is positive. They want to make a decision based on the ELISA test, especially for FELV. You should actually do a confirmatory test, which is an IFA antigen. So the ELISA is positive, but you have to do there are several reasons that it could be positive. So you should not use that as your final diagnostic. You should do an IFA as an antigen test where you do a confirmatory for that. Sometimes it could be, if it's positive, it means it's actually a progressive infection. If it's negative, it's probably a regressive infection, okay? So that's what I want to mention about that. So the moderate reduction in life expectancy. So if you are going to make decisions of putting this animal down based on the results of this test, it's not fair because this animal can still live a long period of time. Even if there is a reduction in life expectancy, but they can live for 3 to 5 years in some of the reports that I've read. It's a normal life that you'll be living. And if you have provided veterinary care, you have all the 5 freedoms that you provide on the animal. If they are all good and provide on this animal, can live long. So the decision of putting an animal to sleep based on this test, I don't think it's a fair one on this particular situation, like most of the places what they want to do. So the carrier state, yes, there's a carrier state. Cats may be viremic and they appear healthy. So on the last part of the diseases, we're going to talk about the FIV. The FIV is also it's caused by an envelope RNA retrovirus. It's affecting the cats. It's not zoonotic, so don't be afraid that it can transmit AIDS from cats to humans. So it's not highly contagious. Primarily, you get it from saliva, like when the cats are biting or fighting between each other. So this is one of the diseases that is characterized as an unfriendly cat. So you have to look at the risks of if your cat is an outdoor cat and is going to be fighting with other cat, that's how we're going to make decisions of vaccinations and stuff like that. We should talk about it later on that. So when the animal is exposed to FIV, they are going to be you can be able to detect the antibodies with the ELISA that we should be using as our SNP test between 2 to 4 weeks post-infection. And then that's when we're going, and then it goes latent. It's latent in a way that it's still growing, it's still destroying the immune system, but not at a rapid phase. And then you start seeing symptoms around 3 to 6 years post-infection, okay? So that's the incubation period. So this animal, you can see that they live pretty long. Some of these animals, they can even die on their own natural causes, not because of this infection. They can live a little bit longer. So decision when we're doing the diagnostic with ELISA and it's positive, and do a Western blot, which is also positive, and that's not the decision that you're going to say, okay, I'm going to put this animal down based on that. It's because these animals, they can have a quality life, where you can live a long period of time, okay? What are the clinical symptoms that normally see? They're variable. Chronic inflammatory conditions like stomatitis, neoplasia, and secondary infection. Those are the basic things that you normally see with these animals. So normally the secondary bacterial infection, they take advantage because the immune system is weakened. Yeah, that's what happens. So the problem with this particular disease is that, one, we have the vaccines. I'm not sure if in America they are there, but in the world, there are the vaccines that you can use to vaccinate for the FIV. But the problem with that is, if we're going to be testing these animals, or if they end up being in shelters, they're tested with this ELISA and Western blot for the antibodies against the FIV, this test doesn't differentiate the animals that are vaccinated from the ones that actually have the clinical, the disease in them. So that will make you to make a decision which is wrong when you are going to put animals down based on the positivity of this test, okay? And also, when the animals are younger than 6 months, this test will give you a false positive as well because of the maternal antibodies in these animals, okay? So that's what I wanted to mention about it. What is the vaccination schedule that we normally do for the FIV? We normally do it 8 weeks, we do it 12 weeks, and we give again at 18 weeks, at 16 weeks, and then we do a booster year. So that's the ideal. But decision to vaccinate these animals has to be, you have to understand the risks of it. You have to understand the environment of this animal. Where is it living? What are the risks that is going to be? Is it going to be outdoor, indoor? Is going to be involved in a fight? Those are decisions that you're going to be using if you're going to be vaccinating. So animals also, it's a carrier that animals will still be, can transmit this disease later on. Okay. So that's all what I heard about the diseases that we're talking about and the characteristics of the microorganisms and how these diseases are in a shelter setting or in the environment. So how do we do? We talked about the vaccinations of these. We're using FVCRP. We talked about the options of vaccinations of FIV and FLV. But now, in a shelter setting, the most important thing is to know how to do the disinfection. So disinfections, we have like 5 different types of disinfectants. The quaternary ammonium, the most common one is Rocalpa, Visoken, okay? The quaternary ammonium, these are the ones that are the colorful ones. When you look at them in where they are being sold, the colorful ones, you normally just pick them with that. We have also hypochlorites, which is bleach, Brooklyn, and with wash. So bleach is a little bit more toxic than the Brooklyn and with wash. So that's why they developed those, the other 2 ones. The peroxygen-based compound, the Axel and Rescue, and the chlorhexidine and the alcohols like isopropyl alcohol and the ethyl alcohols. Those are the part of the alcohols that we're going to talk about. So how do you work with these disinfectants based on the microorganisms that I've talked about there? So the most important thing when selecting the disinfectants is we have to understand what is it that they actually do and what microorganisms am I dealing with. And you also have to know what is the time that we're going to be leaving this in disinfectants. When we're using them, what is their time, the time that we're going to give them, the contact time during the cleaning, which is for all, which is around approximately 10 minutes before you clean these disinfectants. The other thing is, which you also have to consider is, does this disinfectant that I'm going to be using, what does it do with organic matter? What is its efficacy with soaps and detergents? So I'll give you an example. If we're looking at the quaternary ammonium, which are the most commonly used and in all the areas that would, maybe in shelters or for breed or in clinics or hospitals. So these quaternary ammoniums, when there's bacteria which is gram-positive, they are very good. But when it comes to the gram-negative, they are not reliable. There's no data that actually says they are reliable. So if we look at the microorganisms that we have, the bacteria that we have in the upper respiratory disease complex, like chlamydia, like Bordetella, like mycoplasma, they're all gram-negative. So when you select and if you use quartz in the cleaning for these microorganisms, this is not the right selection because there is no sufficient information out there that says they're actually effective against the gram-negatives. Mycobacterium, when there is like tuberculosis and stuff like that, is not that effective. For envelope viruses, it's not that effective, but for non-envelope, it's totally, there's no research that these quaternary ammonium is actually good for the non-envelope viruses. So when you are selecting it, and if there is Callice and there is panleukopenia, which is some of the diseases that we talked about today, if we select the quaternary ammonium, this is not the right disinfectant that we're going to be using there because it doesn't really do anything. We can give an example of sodium hypochlorite. You can use it for the bacteria, for the mycobacterium. For the envelope viruses, it has the effectiveness, which is there, but it's still a little bit doubtful from this research. But there are more research that I've read. They say it's actually a good one to select when there are envelope viruses, like Herpes viruses and stuff like that. And then for the non-envelope virus, it's good to use the sodium hypochlorite. When it comes to the fungi, like the dermatophytosis, which I talked about there, you can use sodium hypochlorite, which is the random bleach, the household bleach that you use, or with wash. You can use that to clean that. But you have to change the concentration now. Instead of using 1:32, which is the normal dilution, we're going to be using 1:10 or 1:10, which is the dilution that we're going to be using for that to eliminate the dermatophytosis, especially the spores. So that's how we are going to go selecting the disinfectants. And once you know the microorganisms that you are going to be dealing with, how you are going to be cleaning, and you have to know also some of them, like the hypochlorite, they are efficacy when the organic matter is so reduced. So you have to do the 3-step process, not the 2-step process. So that's all I wanted to mention about that. So the way if I'm going to select a proper disinfectant, which I think is the best one when I'm dealing with all the diseases that I talked about today, I will select what we call the peroxygen-based one. So if it's the third one, the peroxygen-based compounds, which is the rescue, is one of the best ones. It is effective against most of all the microorganisms that I've talked about that. As long as you provide the contact time, I think that's the best selection of that to be cleaning in shelters. Yeah.
Is there a different disinfectant for a home environment versus a shelter environment?
For a home environment, I would say you can't say there is a good disinfectant for a home environment and that for a shelter setting. No, you have to look at what is it that you are going to be treating. If it's a regular cleaning and you are not worried about any serious microorganisms which are non-enveloped, like Calis virus, like panleukopenia, if you're not worried about those, I would say you can use regular like quaternary ammonium, like the chlorhexidines, like the basic ones, which just covers like certain bacteria and so forth. But if you are really going for the treatment of serious microorganisms like Calis viruses, you really have to look for the good disinfectants. You can use bleach, the household bleach that we're using, you can use it, but for the dilution that we're using for the household bleach regular cleaning is 1:32. That is the one that you're going to be using to clean your house environment for the bacteria and for the viruses which are enveloped and non-enveloped. So household bleach is probably the ideal one for home cleaning if you have serious bacteria that you're worried about.
Is there a different treatment or more difficult to treat an elderly cat versus a kitten with disease control?
No, I think the treatment is almost the same as long as the animals are strong enough to withstand some of the treatment. That if they are not having like organ failures or kidneys or some issues that come with those animals, if they are not there and it's just a regular treatment of a certain disease based on the age-wise, I think it's the same treatment that I will apply. It's not difficult, it's the same. There shouldn't be a problem with that.
And you look at things definitely from a veterinarian point of view with it, but when is the appropriate time to call in a veterinarian versus going through the procedures that you just went through for those that might be in a shelter or at home?
Yeah, so I'll take an example. Let's say panleukopenia, for example, right? You have to see a veterinarian because this disease is aggressive. So if your animal is not vaccinated and is a young animal, right? You have to call your veterinarian. You can't do those things at home. It's as far as the health of this animal is concerned, because it's one of the most difficult and aggressive pathogen that actually kills your animal. So it's better to take it to the vet for that. So for treatment of animals, I don't think you can do it at home, but disinfection, you can do that at home. If you can see like if you know the diagnostic for sure that actually this is parvovirus in this cat, this kitten is having the parvovirus, the diarrhea which is fetid, is bloody and is weak. Then you have to, that's when you have to consider like, okay, if you know it's parvo or you have the information about parvo, I'm sure the veterinarian will still help you to you prescribe the environment, how you are going to deal with the environment with these disinfectants and so forth. So I don't think you can do it alone as far as some of these diseases are concerned, because some of them they are very serious. You have to consult with your veterinarian and then take the recommendation from the veterinarian based on what they found in their diagnostic and implement those at home. So as a veterinarian, they should also treat the animal and treat that environment which the animal comes from. Yeah, okay. So I don't think it's the responsibility for the owner to look for that.
All right, we have one final question as we're wrapping up today. Is there a disinfectant that can be used for outside cats, barn cats, feral cats? Because in Kansas, we have some wide open spaces and we have all kinds of cats. So is there a disinfectant that could be used more for outside animals?
Yeah, the one that I'm talking about for the rescue is really good. It's expensive, that's the problem, but it's really good. It acts when there is organic matter. It's environmentally friendly because it's just a peroxide, it's hydrogen and oxygen. It's a peroxide, so it's really environmentally friendly. So you can use it for outside, but it's expensive. So yeah, I don't think it would be worthwhile, but that's the good one that we'll be using. The other ones that I talked about, some of them, they are not environmentally friendly. They are probably toxic. So I will not recommend to use that. So the only thing, if it's an environment, it's outside. That's why you have to understand the shade period that I was talking about. And you have to understand like the survival of that microorganism in that environment. Like how long does this microorganism survive in the environment? So let's say for Callice virus, for example, it's going to survive a year in the environment. So you have to be careful with that one. So that's why you need to, once you have the diagnostic that is Callice, isolate that animal immediately, limit the environment that is going to be for the proper disinfection of that environment once the animal is recovered. Okay. So if it's I will not want an animal with Callice virus outside. That will not be good, because you would contaminate the whole environment, and there's no way you can use rescue to do that because it's pretty expensive. Okay. So that's probably the possible closer to perfect answer that I have for you.
Well, great.